Welcome back to Local News at 10. Since the Affordable Care Act was passed, there's been much discussion about something called the Medicaid gap in the state of Missouri. The gap is essentially people who make too much to qualify for Medicaid but don't make enough to qualify for tax credits through the ACA. So we recently sat down with a local woman who falls into that gap to try and put a face with this issue. Peggy Learheimer works part-time as a teacher and as an artist, and she's one of the people in the so-called Medicaid gap.
I'm one of these people that has fallen through the cracks. I am currently low income. I've not always been a low income person, but when we had to try and find health insurance, I didn't fit in a category.
Peggy says it's a scary place to be. She says she worries about what would happen if she developed a serious illness or was in an accident.
It's very frustrating, and I feel kind of helpless because it's a matter of what do I do? In other words, I can't afford it. Luckily, the government didn't fine me for not having health care.
Missouri State Representative Charlie Davis says the topic of Medicaid expansion has been a hot topic all over the state ever since the Affordable Care Act passed.
As far as the Medicaid expansion here in the state, it is currently a non-issue. The Senate has already come back and said that they are not interested in hearing any type of talk about the expansion without major reforms, and that's what we're working on now.
Dottie Elbert works for Missouri Health Care for All, which is a group that is working around the Show Me State to try and get the expansion passed.
We've been rallying, doing educational forums. We've done candlelight vigils. A lot of volunteers have gone door to door, making phone calls, driving to Jeff City. We've been talking and feeling like we've not been heard for 3 years.
The question there is, where does the money come from? Currently, the nation as a whole is bankrupt, and the state of Missouri itself cannot fund the Medicaid expansion because the dollars are just not there.
They just need to understand that there are people that maybe need temporary help. You know, we've come on bad times. It doesn't mean we're going to be there for the rest of our lives, but some things need to change for the security of peace of mind of our citizens of the state.
Representative Davis says they are working to do some reform. That way they could free up some money they could use to expand the Medicaid group, but it would not be a blanket expansion. But if the status quo remains, the only other option for those who do fall in the gap is to purchase a catastrophic policy, which is cheaper than a full health insurance plan. Entering now